demand on you care. Incontinence. Bladder training. Bladder training focuses on voiding and diet habitual training so that the bladder capacity is gradually increased. The frequency of urination is reduced and the quality of life is improved. Bladder training instruction. Bladder training usually takes about 3 to 6 months and needs to be persistent. Fill in the bladder diary to record the amount of fluid intake and urine output and the severity of urinary incontinence for 3 days. Healthcare professional will use this information to evaluate the time interval between each urination. You can start your bladder training at home with a toilet nearby so you can practice in a more relaxed environment. Follow the suggested time interval for each urination. Do not void before the time interval set. Avoid going to toilet for just in case. Unless it is before going to bed, do not go to the toilet until the bladder is full. When urinate, achieved as at the set time interval, then gradually increase the time interval until voiding every 3 to 4 hours during daytime. Techniques on withholding urine. While feeling urge, sit still and breathe slowly and deeply to relax. Perform 5 to 6 rapid and intense pelvic floor muscle training in order to minimize the urge sensation and prevent involuntary loss of urine. Distract from urge by counting down from 100, singing, watching a television program, reading newspaper, or listening your favorite songs. Delay voiding, starting from 5 minutes, 10 minutes, and then gradually to 30 minutes or even 1 hour. Don't rush to toilet when feel urge. Should walk slowly to toilet in order to prevent bladder stimulation. When the urge feeling comes again, stand or sit still and perform the pelvic floor muscle training to minimize the urge sensation. Practicing of pelvic floor muscle training regularly every day can help in bladder training. Diet modification. Keep fluid intake with 1200 to 1500 milliliters a day. Seek medical advice if fluid restriction is required. Refrain fluid intake 2 hours before go to bed. Avoid coffee, cola, cold drinks, alcohol and tea. And avoid salty food or spicy foods to prevent bladder irritation. Prevent constipation by increasing high fibers intake. When the frequency of urination reduced to 6 to 8 times a day, the amount of every urination increased to 200 to 300 milliliters per each voiding, the episode of urinary incontinence is reduced or even none. The training is considered successful. If situation of frequent urination or incontinence is not improved, you should contact your healthcare professional.